Ms. Capter of Ohio. Without objection. Gentleman is recognized for 5 minutes.
Thank you, Madam Chairman. You may recall that a few weeks ago, President Obama came to this chamber and he addressed the chamber on health care before a joint session of the House and the Senate. During that session, I was privileged to be here, and I saw my colleagues on the far side of the aisle, the Republicans, waving pieces of paper during his speech. And I was wondering what they were. I couldn't imagine. It almost seemed like they wanted President Obama's autograph. I just didn't get it. I heard from one of my colleagues that this is what they called the Republican health care plan. I went over after the speech was over. I picked up a copy that was lying down on the Republican side, and it turns out that the Republicans' health care plan was a blank piece of paper. I inquired further, trying to find out exactly what the Republicans' health care plan is, and it's my duty and pride tonight to be able to announce exactly what the Republicans plan to do for health care in America. It's this. Very simply, it's a very simple plan. Here it is, the Republicans' health care plan for America. Don't get sick. That's right, don't get sick. If you have insurance, don't get sick. If you don't have insurance, don't get sick. If you're sick, don't get sick. Just don't get sick. That's what the Republicans have in mind for you, America. That's the Republicans' health care plan. But I think that the Republicans understand that that plan isn't always going to work. It's not a foolproof plan. So the Republicans have a backup plan in case you do get sick. If you get sick in America, this is what the Republicans want you to do. If you get sick, America, the Republican health care plan is this. Die quickly. That's right. The Republicans want you to die quickly if you get sick. Now, the Democrats have a different plan. The Democrats say that if you have health insurance, we're going to make it better. If you don't have health insurance, we're going to provide it to you. If you can't afford health insurance, then we'll help you to afford health insurance. So America gets to decide. Do you want the Democratic plan or do you want the Republican plan? Remember, the Republican plan, don't get sick. And if you do get sick, die quickly. Thank you very much, Madam Speaker.
Mr. Jones of North Carolina. Congressman Burton will be recognized for 5 minutes.
I can't believe what I just saw. I can't believe it. First of all, it's totally wrong. And secondly, it's making fun of a very important issue for the American people. We do have health care problems in this country, and we need to solve those health care problems. But coming down here and making light of the issue by coming up with a lot of silly talk is just ridiculous. The Republicans have a bill, H.R. 3400, which deals with the problem in a way that does not get the government in between the patient and their doctor. My colleagues on the other side of the aisle want to come up with a government plan where the government starts making all the rules and taking a major place in between the patient and their doctor. And you know, I like to say to my friends across the country, if they happen to be watching, and my colleagues, and I know I can't do that, I can't address anybody except my colleagues, but if I were talking to the people across this country, I'd like to ask them, what government agency has done such a great job that you'd want to rely on them for your health care? Just start naming a couple. And what government agency has done such a good job that they're not spending much more money than you anticipate they're going to spend? And then think about health care. The projections are that the Democrats' plan is going to cost between $1 and $3 trillion over the next 10 years. Money we do not have. Money that your kids and your grandkids are going to have to pay for with higher taxes and inflation. And they say that we don't have a plan. We do have a plan. We want to allow businesses to band together so they can get the best rates, like major corporations. We want businesses to be able to go across state lines to buy insurance at the best rate possible. We want to set up medical savings accounts so people will have the money of their own, tax-deductible money put into the account by them and their employer, and they can use it as they see fit for medical coverage. And then if there's a major expense above the $2,000 or $3,000 of their money that's in the bank, you can have a major medical policy, which would save an awful lot of money. There's no question that we have maybe 10 million people in this country who are indigent, who don't have health care, that we need to deal with. Not the illegal aliens, not the people who elect not to have insurance, but but the 10 million people who really don't have it and need it. And in our plan, H.R. 3400, we address that. And we could solve this problem for a few $billion, not trillions of dollars, like the Democrats talk about. And in their original bill, they talk about we're waiting for people to die. In their bill, they had a phrase in there that said, or a paragraph in there that said, you should have regular meetings with paraprofessionals to talk about end-of-life planning. End-of-life planning. That's something that should be between an individual, their pastor, and their family, and their doctor. I'll be happy to yield to my colleague from Tennessee.
Can they do that?
Republicans want that our health plan is to hope that all the people die quickly. I've been here 21 years, and that is about the most mean-spirited, partisan statement that I've ever heard made on the floor of this House, and I, for one, don't appreciate it at all, and that brings the debate on this important issue to about the lowest level of any debate I've heard since I've been here. I yield back the balance.
I'll be happy to yield to my colleague from Georgia.
I appreciate my friend from Indiana taking this time. The gentleman from Florida, Mr. Grayson, is still on the floor. He could have an opportunity to come down and apologize to the House right now for denigrating this discussion and this debate, for debasing members of not just the House of Representatives, but this entire nation. It's shameful what's been done. Mr. Grayson, how about apologizing? Mr. Grayson? Mr. Grayson, how about apologizing?
I think Mr. Grayson's left the chamber.
I thank the gentleman.
If the gentleman will yield.
I'll be happy to yield to my colleague.
I thank the gentleman.
Excuse me, I just want to, gentlemen will suspend. I want to remind everybody to direct their comments to the chair.
I thank the gentleman for yielding, and Madam Chairman, I find it just so unfortunate as we are seeking to address and find bipartisan agreement on an issue of paramount importance to the American people, on an issue that our seniors continue to talk to us about every day because of their concerns over Medicare, what the delivery is going to be, that we would have someone, Madam Chairman, who would come to this floor and would make such a statement and would make such accusations. And Madam Chairman, I think that it is fully appropriate that the gentleman return to the floor and apologize to the members of this body, and I yield back.
Gentleman's time has expired.
Let me just say as we end, Madam Chairman,
Gentleman's time has expired.
and that is that we don't want rationing for seniors, and we don't want $500 billion taken out of Medicare.
Gentleman's time has expired. Thank you. Ms. Rose Lehtinen from Florida, you can address the House for 5 minutes.